So this is the volunteer training for supporting people in times of stress through peer support, and we'll talk about doing some signs of stress and trauma, as well as practicing self-care, and then also talk about active listening. What makes somebody a good volunteer or a good support person? We're looking for somebody who has good communication skills, and we'll talk about the ability to listen, ways to listen effectively, to understand what someone's saying, to question if needed, to clarify. It's helpful to have the ability to motivate, desire to make a positive difference. It's really important to be approachable and to be flexible and to really be open-minded. And we'll talk also about empathy, showing empathy, which is different from sympathy. And we'll talk about being respectful. So the stress response. We're going to talk about the stress response and kind of some of the adaptive ways that our bodies respond to stress and some ways that can be harmful or challenging. So stress. What is stress? Stress can be defined as our mental, physical, emotional, and behavioral reactions to any perceived demands or perceived threats. It's also a physiological responses. So our body has a physical response, and these reactions can accumulate, and that can result in long-term kind of strain on the body. Fight or flight. So when situations seem threatening to us, our bodies react quickly to protect ourselves by taking action. This physiological reaction is known as fight or flight. This is a reaction that's really, really helpful when we are in danger. So if I'm going for a hike and a bear comes my way, and I want my body to respond, to go into fight or flight mode. I want my heart rate to increase. I want the blood to get diverted to my major muscle groups so that I can fight or flee. I actually want to perspire, because the perspiration or sweat can make us harder for predators to catch. So I want all these things to happen. It's actually adaptive. What happens though these days is that we experience forms of stress or threats that are not actually life-threatening, and our body has the same physiological reaction, and that's pretty uncomfortable. Okay, the stress response. So we know the brain and the body respond to what we perceive as a threatening situation. And we all might perceive situations differently. So what I might perceive as threatening, someone else may not perceive as threatening. Certain people perceive talking in front of large groups of people as threatening. Other people do not. Again, it's important to remember the stress response is actually our natural defense against danger, and it's really a protective mechanism. But when it happens out of context, or when it happens in the absence of a real threat, it can feel really uncomfortable and confusing. Types of stress. So there's two different types of stress: distress and eustress. So distress is the experience of feeling overwhelmed, oppressed, and behind or unable to complete our responsibilities. So these examples, and you'll probably see these a lot currently, could be financial difficulties, conflicts in relationships. So when we're maybe isolated to our home, maybe we're around some of our family members in tight quarters, chronic illness, and experiencing a trauma. And we'll talk more about trauma later. Distress. So this causes anxiety or concern. It can be short or long term. Typically, it's when we perceive the source of stress, as outside of our ability to cope with it. Like we don't have the internal or external resources to cope with it. It feels really unpleasant. Typically, it decreases our performance, and it can lead to mental and physical problems. We'll talk more about that later. Eustress, on the other hand, that's another form of stress that's actually positive and beneficial. So eustress, those examples could include graduating from college, getting married, having a baby, getting a new job. So often in those situations we feel challenged, but the sources of the stress are opportunities that are meaningful or important to us. Eustress can actually help provide us with energy, and it can motivate us. So we want to have some level of stress, because stress actually can motivate us to meet our responsibilities and achieve our goals. Eustress, again, it motivates. It can actually focus our energy. Typically it's short term, and it's perceived as within our ability to cope. So we feel like we have the resources to respond and to cope with it. Typically it improves performance. So we'll just see this. This is the Yerkes-Dodson curve, and it shows that when we have too little stress, we're actually not motivated enough. So we can be inattentive. We can be actually too laid back. We're not responsive. We're not motivated. We're not engaged. There's actually an optimum level of stress, which is the yellow zone. Then once we hit that peak, it can be too much. We can start to feel fatigued. We can hit exhaustion. Then it could actually go over into the red level, which is burnout. Our resources are tapped. We feel anxious. We feel panicked. We feel angry. We could break down. Factors that contribute to stress. So situations that have really strong demands and are demands that we feel like we can't meet. Really significant life transitions. Ambiguity. So when we don't really know what's going to happen. We're kind of in that situation right now. We don't know how long it's going to last. Desirability. Are we in a situation in which we really want to be? And controllability. How much control do I have over this situation that I'm in? It's important. Signs of being overstressed. So someone that's overstressed, they may feel constantly pressured, hassled, hurried. They may notice anxiety or panic attacks. So those are like this, typically a panic attack is when you have this increase in really uncomfortable physiological sensations like trouble breathing, heart rate increases, you might feel dizzy or faint, those kinds of situations. That's a panic attack. We might notice irritability. People are irritable, moody, short-tempered. People can have physical problems like their stomach feels upset. They get headaches. They might even experience chest pain or tightness. A lot of times it's not uncommon for people to think they're having a heart attack when they have a panic attack. And they may often experience problems sleeping, difficulties falling asleep, staying asleep, or waking up too early. What is trauma? So trauma is our events that are outside of kind of our normal life experiences. They cause intense fear or helplessness or horror. And typically they exceed that person's ability to cope. So that person doesn't have the internal or external resources to cope with it. What makes an event traumatic? So this is similar. It basically involves a threat, and it can be a real threat or a perceived threat. So again, what one person perceives as a threat may be different than what someone else perceives. And it's to our physical well-being, so being physically attacked, or it can actually be to our emotional well-being. It's overwhelming. It results in really intense feelings of fear and not being in control. Typically, it leaves someone feeling helpless. It often impacts the way that we view the world, ourselves, and other people, and it can really shift our belief system. Examples of trauma, so we can have, singular events like a car accident, a natural disaster, maybe a crime, being the victim of a crime, going through a surgery, experiencing the death of a loved one, another violent event. It could be a sexual assault, physical assault. There can also be chronic or repetitive experiences. So that could be child abuse that occurs over time, neglect, physical neglect, emotional neglect, somebody in a combat situation. You see this in people who've been exposed to concentration camps, domestic violence relationships. So children who are family members who are experiencing extreme financial hardship and they don't have access to the resources they need. So impact of trauma. Trauma can result in people feeling helpless, feeling confused. They can feel loss or grief. They can have a grief reaction. They can feel that their trust was betrayed. They can have a lot of pain issues. So, we know trauma, we often say trauma is held in the body. So people may experience, uncomfortable, distress in their stomach, upset stomach. They might notice pain in different parts of their body, migraines, headaches. There could result in post-traumatic stress disorder, anxiety disorders, depression. People may use substances to attempt to cope, and that can impact our ability to function in our daily life. So it can impact relationships, our ability to parent, our ability to get our job done. Okay, this is just kind of some more symptoms of traumatic stress. So again, there's the physiological, which is like our immune system could be lowered, can feel really tired, really aching, emotional. We can feel powerless. We can actually feel numb. So we can feel really strong emotions. We can feel almost the absence of emotions. We can feel really confused. Well, that's kind of gonna be more on the cognitive, but it can feel sad, helpless. Behavioral, we might feel irritable. We might have trouble eating or sleeping. We might start to isolate from people. We could be on edge. We could be easily startled. Spiritual, we might feel a loss of purpose. We might start to question some of our spiritual beliefs. Cognitive, it can become very difficult to concentrate. We can get really preoccupied with specific experiences. We can start to doubt ourselves. We can have these intrusive memories that are upsetting. And relational, we can start to withdraw. We can, have a lack of interest in intimacy or sex. We can isolate from family or friends. We might even project our anger onto others, start to mistrust others. So in the midst of this, what can we do? Practice self-care. We hear about self-care all the time. What is self-care? Self-care is what people do for themselves to establish and maintain health and to prevent and deal with illness. So that could include hygiene. And for some people, it's just going to, can we encourage people just to practice basic hygiene? Nutrition, what kind of food are we eating? Are we eating healthy foods? Are we eating enough food? Are we taking in enough calories? Lifestyle, are we engaging in any kind of leisure activities? Are we engaging in any kind of exercise? Environmental factors, like what are our living conditions like? What are our social interactions like? And then there's socioeconomic factors. So again, obviously our income level is affected as well by self-care. Cultural beliefs influence what we do for self-care. Ways to manage stress. So some of these we can control. Some of these might be possible. Stop overscheduling. If possible, limit your commitments. Prioritize. Talk to people who can help. That could be a family member or a friend. It could be a counselor. It could be a pastor. It could be a neighbor. Get the proper amount of sleep if possible. It's really difficult. I know for parents with young children, their sleep's interrupted multiple times. So it's really wanting to get consecutive hours of sleep. Maintain a good nutritious diet if possible. Exercise daily, again, even just a few minutes throughout the day of exercise. Getting outside to exercise if you can. Playing with your kids, that can be exercise. These days we jump on the trampoline a lot. That's exercise. Relaxation techniques. You can find a lot of that on YouTube, or you can listen to it on a podcast, just practicing breathing, maybe some yoga stretches. Okay. Beliefs that can help manage stress. So, trying to talk to people, help people think of their current stressful situation while thinking of change, so that, life changing, experiencing changes is challenging, but it's also a normal part of life. Trying to view setbacks or trying to view current stressors or problems as being temporary. So if we can view them as temporary versus viewing them as enduring or unending. And also viewing them as being solvable, or at least having kind of breaking down what we're dealing with into pieces that we can address or solve. So that can involve, working on problem solving. That can involve breaking down the situation into and kind of doing the things you can do to control your situation. See, believing that you will succeed, again, that's kind of setting reasonable and achievable goals. Taking action. So if problems come up, as opposed to postponing or trying to avoid, kind of doing what you can. Building strong relationships. So with family members and friends. Having a support system, being willing to ask for help, being willing to reach out to others or organizations or agencies. And as best you can, making time to participate in activities that you enjoy, even if you're feeling down and depressed and nothing really sounds appealing, kind of going back to those things that you used to enjoy and trying to engage in some of those activities. So now we're going to switch over into active listening. Active listening is a form of listening and really hearing people that counselors typically use in their counseling sessions. So, active listening. Are you a good listener? Do you frequently interrupt others? Do you complete sentences for people? Do you silently criticize what the person is saying in your head? Do you frequently think of other things? Your mind wanders. You're thinking about something else when someone's talking to you. Do you only selectively hear ideas that fit your beliefs and maybe ignore the rest? And do you listen passively without really showing any facial expressions? So what is listening? If you ask a group of people to give a one-word description, a lot of people would probably say hearing. But listening is following and understanding. It's hearing with a purpose. So definition of listening. The process of we're receiving information, we're kind of deriving meaning from that information, and then we're responding to what was said with spoken or verbal and nonverbal messages. So we're hearing what's said, and we're paying thoughtful attention. So listening versus hearing. Hearing is a physical process. It's natural. It's pretty passive. Listening is physical and mental. It's active. It's a skill. It's hard. You have to choose to participate in the process of listening. What's empathy? It's a reflection of the content, the words that were said, and the feeling. So kind of a deeper level. And what's the purpose? We're trying to understand what the person may be feeling. Empathizing. Empathizing does not mean you have to agree with the person, does not mean you need to give in to the person and what they're saying. But what it does mean is you don't automatically dismiss what the person says as ridiculous or silly. How to know when we're showing empathy? Well, if our body language, what we're doing with our body, and our tone of voice matches, if the tone of voice and how I'm feeling matches, we'll talk more about this, and if you're focused on what your partner is saying and meaning. So what is active listening? It's a way of listening and responding that improves mutual back and forth, both of us, understanding each other. It's a way of paying attention to other people in a way that makes them feel like you are hearing them. It's active because it requires certain behaviors on the part of the listener. Benefits. It forces people to listen attentively. It tends to open up the speaker. It tends to get them to even say more. It shows empathy, and it typically builds relationships. Goals for the listener is to maximize our understanding of the other person's perspective, and also to minimize or decrease their defensiveness and our own. So when someone feels heard, they're less likely to feel defensive. Key concepts. So we want to show that we're involved in what they're saying. We want to really observe the person. We want to try to resist being distracted. Best stay focused. Ask for clarification if you don't understand. It's okay to ask for clarification, to ask questions, and to try to pause and to delay making judgments. Active listeners spend 30% of the time. They speak 30% of the time, and they listen 70%. So you may have to try hard not to interrupt. We can interrupt, though, is if we need to clarify or confirm what has been said. Why is it hard? When people are preoccupied with our own stressors, it's hard to listen. When we feel anxious, it's hard. When we're angry, it's hard. When we have an idea of what that person should do, it's hard to sometimes listen to their perspective. So we'll quickly go through some steps of active listening. It's listen, question, reflect, or rephrase. Sorry about that. So listen. We want to listen to what's being said, the content, but also the feelings underneath that. We want to focus on what the speaker's saying, not planning what we're going to say. And then we can also use verbal or nonverbal encouragers. And that is things like, oh, okay, right, sure, yeah. That's really just us responding, acknowledging that we're hearing them, and then giving them permission to continue speaking. Question. We can also, so when we're practicing active listening, we're also going to question. Why is that? We're going to demonstrate, we want to show that we're listening. We want to gather information, and we want to get clarification on what the person's saying. So when you ask questions, you want to show interest. We're really trying to encourage them to explain more, to talk more. And it's okay you want to ask questions, but not too many. So there's open-ended questions. That's like, what happened? Meaning, trying to find meaning, what do you mean by that? We can look to see how that made them feel. So how do you feel? can look at kind of their motive, like, what do you want to do about that? And action, or like, what will you do? What are you planning to do? A lot of times we want to avoid why questions if you can, because why questions can sometimes make the person feel defensive, or that we're judging them. So other questioning tips: avoid asking multiple questions at once. Again, we're not interrogating them. It's hard for them to kind of answer. We want to let them answer the question before we start piling on more. Open-ended questions, that's questions that require more than a yes or no answer. How are you doing? Tell me. It could even be a statement. Tell me about your day. Tell me, how did that make you feel? As opposed to, did you like that? That can just be a yes or no answer. Kind of like how you talk to your kids. If you give them the chance to give you a short yes or no answer, they're going to do so. So you want to kind of ask in a way, a how, a what, a tell me about, that encourages them to open up more. Best questions are short, clear, objective, and go ahead and allow for some quiet time. It's okay to allow for silence. Let the person, think before they may have to think about what they want to say before they respond. There's the last part is reflecting or paraphrasing, and we'll just go through a couple of those. We don't really need to do all those techniques, but sorry, I just drew that line again. So reflecting is just reflecting what the person said, but in your own words, and reflecting what you think they may have been feeling. So if someone says, "Don't worry, I'm fine," but they look upset, if you're reflecting, you can say, "Well, I hear you say you're okay, but it's like by the tone of your voice, you seem upset," or like your facial expression, you kind of look upset. I'm wondering I'm wondering how you're feeling. Reframing, you may or may not have a reason to do this. A lot of times that when we hear people being extremely negative, we might want to help people see their concerns in a new light. So we might help them look at the situation using more positive or neutral language. So an example would be if someone says, she never comes to me when there's a problem. She just talks to everybody else. And the reframe could be like, it sounds like what you're wanting is some direct communication. Again, this is more of a therapy technique. I don't know that you're going to really need that. Paraphrasing. So that's just paraphrases the speaker to acknowledge the story. So it's really just to see, you're kind of paraphrasing, you're kind of summarizing and saying, like, did I get this right? So let me see if I got this right. You're upset because you think we're going off in the wrong direction and you want to clarify before we do this. Is that right? Clarifying is not parroting. So you're just putting it in your own words. Okay? You're not like just repeating back verbatim what they said to you. You're really like repeating back to them what you heard to check for accuracy, and then it gives them a chance to correct you. Acknowledge. Problem solving may not work if someone's feeling a lot of really strong emotions. It can be really helpful to first acknowledge their emotions before we attempt to problem solve. So acknowledging, boy, it sounds like you're really frustrated by that, or it sounds like you're really feeling hurt by that, as opposed to immediately jumping into problem solving or trying to fix. A lot of times people just want to be heard. They want us to hear they want us to hear them and to validate their emotions. So to acknowledge how they feel and to kind of validate how they feel as well, as opposed to trying to fix it for them. Last part, summarizing. So why do you do it? It's just to kind of review where you're at and try to pull the information together. And it's really just restating the ideas you heard as well as the feeling. So let's see if I have a clear understanding. So basically what you said is, and you just kind of summarize what has been said. That's the end of the presentation for right now. I will I welcome any questions you have about this or any comments. I'm going to try to post this, and I will follow up with some additional videos. You can email me at scwaves, WAVES, 4 women, WOMEN. It's all one word, scwaves, 4 women, at gmail.com if you have any questions, and I will be sending some more videos your way. Thanks.